Coronaviruses were discovered in the 1960s. The earliest ones discovered were infectious bronchitis virus in chickens and two viruses from the nasal cavities of human patients with the common cold. They are a group of viruses that cause diseases in mammals, including humans, camels, cats, bats, and birds. Really, animal coronavirus infect people and then can spread from person to person. In humans, the virus causes respiratory infections, which are typically mild, but in rare cases can be lethal. In cows and pigs, they may cause diarrhea, while in chickens, it can cause upper respiratory diseases. There are no vaccines or antiviral drugs that are approved for the prevention and treatment of the coronavirus. The name coronavirus is derived from the Latin corona, meaning crown or halo. This refers to the characteristic appearance of the virus by the electron microscope, which have a fringe of large bulbous surface projections, creating an image reminiscent of a royal crown or solar corona. And you can see from the image on the screen there. Human coronaviruses. Some common human coronaviruses cause mild to moderate upper respiratory tract illnesses like the common cold. Most persons get infected with these viruses at some point in their lifetime. These illnesses usually only last for a short amount of time, and the symptoms may include runny nose, headaches, cough, sore throat, fever, or a general feeling of being unwell. And I'm pretty certain most of us would have experienced some of these symptoms at some point and may have been infected with one of the human coronaviruses. Human coronaviruses can sometimes cause a lower respiratory tract infection also, such as pneumonia or bronchitis. The persons who suffer most from these are persons who have pre-existing conditions, example, cardiopulmonary diseases, or persons with a weakened immune response, or persons at the extremes of age, for example, infants and the elderly. There are 7 strains of human coronaviruses that affect human beings, the 4 that I mentioned earlier that cause the common cold-like symptoms. We also knew about the severe acute respiratory syndrome coronavirus, or SARS, that had an epidemic several years ago, and the Middle Eastern respiratory syndrome coronavirus. However, the virus that we are here to discuss today is the novel coronavirus, also known as Wuhan's pneumonia or Wuhan's coronavirus. It is called novel because it is newly discovered, and this is a placeholder name that is used for most viruses that are newly discovered. Now, where did it start? The source of the coronavirus is believed to be at a seafood market in the central Chinese city of Wuhan. The city's health commissioner said that the infection broke out between December 12th and the 29th, with some patients who were employed at the market. The animal source of the outbreak has been identified as originating from bats. The market in Wuhan is now shut down, and it was home to trading in many different types of exotic animals, including snakes, bats, also dog and poultry. These are called wet markets and are popular in China, where persons buy their meat freshly slaughtered, which are called warm meat. The response from China has been commendable. Across China, the New Year's celebration have been curtailed because of the massive amount of persons who would have been on the street during these celebrations. And the Chinese authorities have placed restrictions on about 10 Chinese cities, including Wuhan itself, which is about 11 million. As a matter of fact, nearly 60 million people remain under lockdown in China in an attempt to curtail the spread of this virus. The health workers from China have been basically overwhelmed with the infection, and they have put a number of things into place. For example, there's a 1,000-bed hospital that should be completed today, and they're supposed to be building another one that's going to be completed in a few weeks. How quickly has this virus spread? Since the outbreak in mid-December, cases have escalated in pace, As of February 3rd, which is today, the global death toll stood at 362, one being in the Philippines, the others in China, and 17,300 persons infected in about 28 different countries. And this is a list of the countries, and I'm sure that you can recognize a lot of them there. China, of course, Hong Kong, Australia, Canada, France, Germany, the United States, United Kingdom. So the disease has spread to quite a number of countries. How is it spread? Most often, the spread is from person to person, and you have to have contact, usually within about 6 feet. And so if you are some distance from someone who has the coronavirus, you're not going to catch it. Some persons think that the virus is flying around in the air there, but you can be in the same space with someone who has the coronavirus, and you may not catch it. Person-to-person spread is thought to occur mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how the common cold or influenza is spread. These droplets can land in your mouth or by your nose, and then you can inhale them into your lung and get the infection. It is currently unclear if a person can get the coronavirus by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possible eyes. Typically, most respiratory viruses, people become contagious when they are very symptomatic or when they are sickest. However, there has been a documented case of someone spreading the coronavirus even without symptoms. What are the clinical presentations? The complete clinical picture with regards to the novel coronavirus is still not fully clear. Reported illnesses have ranged from infected persons with little or no symptoms, or people being severely ill or dying from the disease. And these symptoms include fever or chills, runny nose, muscle aches and pains, conjunctivitis, and symptoms of lower respiratory tract infection. And so you can see these symptoms mimic those of the flu-like illnesses, and we are in the middle of the flu season also, so it doesn't necessarily mean that everyone who is coughing or sneezing or who has a runny nose has the coronavirus. Of great concern is that asymptomatic patients may be transmitting the disease also. The incubation period is thought to be between 2 to 10 days, and this came from the World Health Organization, which means that one can have the virus for about 2 to 10 days without having any symptoms at all. The persons who are affected, it's mainly men so far, about 56% of men, with the median age being 57, and the age range from 26 to 89. And the percentage of cases that progress to severe disease is about 20%, and death 3%, which means that 80% of persons who have the disease don't have any severe respiratory problems. Now, how do we prevent this? The best way to prevent the infection is to avoid being exposed to the virus. So you should wash your hands often with soap and water for at least 20 seconds. And you can use an alcohol-based hand sanitizer that contains about 60% alcohol if soap and water are not available. Avoid touching your eyes, nose, mouth with unwashed hands, because that's how you would transmit the virus to yourself. And avoid close contact with people who are sick. And don't forget, I said you have to be within 6 feet of someone for them to transmit it. If you are sick, one should stay home. And so the employers should be cognizant of this. And you should cover your mouth when you cough or sneeze with a tissue and then discard of it in a trash can. If not, then you sneeze into your elbow. And one should clean and disinfect frequently touch objects, for example, laptops, etc., doorknobs. Yes. Is there a vaccine? The answer is no. And some pharmaceutical experts warn that a vaccine may not be coming for a number of years. However, Beijing was quick to share the genetic code of the virus, and because of this, a number of organizations are working around the clock to see if they can produce a vaccine that hopefully should be ready soon. However, for now, the most important way of dealing with this is through containment. I thank you.